A huge cash injection of £22.6 billion into the NHS was announced in today's budget. But the Health Secretary has warned that this funding would only arrest the decline of the struggling health service and that it cannot be fixed in a single budget. And without a firm grip on social care and employing more staff, hospitals are likely to remain overwhelmed. So is it enough or is it a sticking plaster? And when will we actually feel the boost? I'm Lucrezia Millarini and this is What You Need to Know. Hello and welcome to today's episode of What You Need to Know. And I'm joined by our health correspondent Rebecca Barry and our health and science producer Phillip Sime. Thank you so much for talking to us today. So listen, Rebecca, just give us some context. How much extra is the NHS actually getting?
Well, firstly, just to point out that health is a devolved issue in the four nations of the UK. We're focusing on England today because Westminster has responsibility for the health service there. Today, the Chancellor, as you say, announced a £22.6 billion increase in day-to-day funding for the health service. That's a 4% increase in real terms, the highest rise since 2010 if you exclude COVID. The Chancellor also announced money to help tackle the waiting list, and we can listen to what she said.
To increase capacity for tens of thousands more procedures next year, we will provide a further £1.5 billion for new beds in hospitals across our country, new capacity for over 1 million additional diagnostic tests, and new surgical hubs and diagnostic centres, so that people waiting for their treatment can get it as quickly as possible.
All right, so all this extra money, but when will people start to see the impact?
Well, do you want the good news or the bad news? I'll start with the bad. If you go to A&E this winter, it's very likely you could still end up waiting hours to be seen. If you're one of those 6 million or so people waiting for routine treatment like a hip or knee replacement, that waiting list is not going to vanish anytime soon. The government's made it abundantly clear that despite these billions of pounds, this is not going to be a quick fix. When I interviewed the Health Secretary last week, he even admitted to me that we will still see people being treated on trolleys in hospital corridors this winter. But on a more positive note, there is some light at the end of the tunnel in terms of money. As you heard there, the Chancellor has announced £1.5 billion for more beds, scanners and surgical hubs. And yesterday I went to visit one of these surgical hubs in North London. It's Chase Farm Hospital in Enfield. It's one of 110 surgical hubs in England. Research has shown that they can increase the number of operations performed by 20%, and the specialist teams there carry out really common procedures like cataract surgery, hip operations, knee surgery, and they're really efficient. They run 7 days a week. They have this enormous state-of-the-art barn theatre where senior clinicians can even oversee 2 operations at once. And I actually spoke to a patient on the operating table as he was having surgery on his hand. He spoke to me whilst he was having that procedure. He didn't have a general anaesthetic because no general anaesthetic means that you can recover more quickly and be discharged more quickly. And here's what he had to say to me.
And when do you expect to go home?
Today.
Today?
Yes. And I hope to be gardening in 3 weeks' time. And when people say NHS is broken, it's simplistic and a nonsense. I've had fantastic treatment.
Well, that was a first for me, interviewing someone on an operating table. Look, while many people welcome this long-term investment, there's still real concern about the immediate crisis facing the NHS. In response to the budget, the Royal College of Nursing have already issued a statement. They say this new funding and upgrading of NHS facilities is long overdue. It's also true that new scanners, more beds and extra appointments need staff. A depleted, worn-out and undervalued profession can't bring down waiting lists and transform care.
And that's not going to change overnight, is it? That's NHS funding. Another really huge concern, of course, is social care. What did the Chancellor say about that?
Yeah, I'm sure this is something that many of our listeners and viewers at home will be worried about, the crisis in social care. It's thought around 1.6 million elderly people in England aren't getting the care that they need, and there are more than 5 million unpaid carers in England and Wales. Although spending on social care in England has increased in recent years, it hasn't kept up with demand and increased costs. And every single day, thousands of people who are well enough to be discharged from hospital can't leave because there simply isn't the social care in place. And that means there's a knock-on effect on lots of other people who need hospital care but can't get it. I think last month, every day, there were around 12,500 hospital beds that were taken up by people who should be discharged. Many say until the government gets a grip on social care, hospitals will remain overwhelmed. And today, the Liberal Democrats are saying that social care is the elephant in the NHS waiting room. Lib Dem leader Ed Davey urging the government to end the dither and delay and begin cross-party talks on social care now.
Philip, what about public health? Did that get a mention today?
Yeah, well, one way we can reduce the pressure on the NHS is just to use it less, and that means being healthier as a population, but helping people to make healthier choices in the community, not in hospital, means money. But we know these services are really stretched. So we heard from one public health director in Newcastle who says that her services can help only around a third of people who would benefit from support for alcohol use. And that's not surprising when you realise that the public health grant, which helps these local authorities provide these services, has been cut by 25% since 2015. Now, this budget emphasises a new focus on prevention, which will please public health experts, but it doesn't specifically mention the public health grant. So we don't yet know if the increase in funding that we've heard about will feed through to an increase for local authorities. A few other things that will please public health experts were an increase in the soft drinks levy, a one-off tobacco duty rise, and a new duty on vapes. Is it enough? Well, the challenge is huge. And this fact I read earlier puts it in perspective. Cardiovascular disease, which is largely preventable through lifestyle choices, costs the NHS around £7.4 billion every year. And that's only going to increase over the next 10 years. Yeah. Reversing that trend is crucial if we're going to reduce the burden on the NHS.
Certainly a start, isn't it? Something else that we have spoken quite a lot about in the last couple of years, and that's about getting to see a dentist on the NHS. Is that going to become at all easier now?
There wasn't much mention of it, was there?
There wasn't. We've probably all struggled to see an NHS dentist at some point, and we've definitely all heard the horror stories. Most people would call it a crisis in NHS dentistry. A few months ago, we spoke to one woman in Lincolnshire who struggled for 3 years to access an NHS dentist, and in the end the pain was so much that she ended up pulling out 12 of her own teeth with pliers. And it's stories like that that prompted the Health Secretary to promise 700,000 more appointments and a pledge to hire more dentists. The budget didn't highlight dentistry itself. We spoke to the British Dental Association earlier. They're looking for clarity that increase in appointments is still going to happen. Yeah. At the moment, they don't know if it will.
Yeah. Another thing that we've been seeing in the headlines recently is cancer care and how it needs to be radically improved here in the UK. Any mention of that in the budget today? Yeah,
the UK has higher cancer mortality rates than other countries. Recently, we did a report here on ITV News about radiotherapy, revealing that a quarter of England's radiotherapy machines are going to be out of date by the end of this year. Radiotherapy is one of the three main treatments for cancer alongside surgery and chemotherapy. But campaigners say that it's chronically underfunded. There was some good news in the budget today. The Chancellor promising £70 million for new radiotherapy machines. And in reaction to that, Pat Price, who's a leading oncologist and one of the people we spoke to as part of our report, she said that it is a vital step forward to address the cancer crisis.
It's a step forward, but we are lagging quite far behind, aren't we?
Yeah, hugely. I mean, the recent Lord Darzi report said that we lag behind other similar developed countries, and there's been very little progress in catching cancer early enough to prevent it becoming fatal.
Yeah, and that obviously is the key. Well, listen, Rebecca, Philip, so much to go through, and I'm sure you'll spend a large part of the rest of the day going through all the figures, but thank you so much to both of you for now. And just to say thank you all for listening and for watching. And for more on this, please head over to our website or ITVX. And of course, have a look back through our other quick briefings on a range of headline topics to find out what you need to know. Until the next time, thank you.